and we have some compound butter, and here are some remnants of this turkey. I removed the tips and I actually cut out the backbone. The term for that is spatchcock. I'm not sure what the derivation of that term is, but now the game plan is to place the compound butter subcutaneously or subjacent to the skin. And I've seen many talented chefs on YouTube and various other video sources place his or her fingers underneath to try to do the dissection. And invariably, it doesn't appear satisfying. When he or she places the compound butter, there's resistance and so forth. Folks, I'm a retired surgeon, and let me show you how a surgeon would approach this. First of all, he or she would recognize the importance of retraction. So I have this spoon here, and I'm going to use this as a retractor. Okay, first I'm going to do some gentle dissection, and you see this fibrous tissue here. This is the tissue that a finger does not efficiently dissect through. So when I confront this, when it appears in the dissection process, I'm going to switch to the scissors. And because I don't want to cut the overlying skin, I'm going to spread. Spreading is the surgeon's friend. So we're going to spread and snip. We're going to push down with the scissor here. I'm now using my hand as the retractor, which is not as elegant, but it does the job. See that fibrous band here? A finger is not going to efficiently go through that. So I'm going to keep spreading and snipping. Spreading and snipping. Folks, this is how a surgeon dissects. Not with fingers. You don't see a surgeon in the operating room, as far as I've seen in my 30 years plus experience, use his or her fingers to dissect. Okay, so now we got this, for lack of a better term, spatula that I'm putting tension down and raising the fibrous tissue. So folks, that's basically it. Look at that fibrous tissue. A finger, or fingers plural, is not going to efficiently get through that. Spread, snip. Spread, snip. Retraction. Spread, snip. Okay. And when you do this circumferentially, this is the turkey breast here, down below, you're exposing all the interstices, all the distal. Spread, snip, spread, snip, retraction. And you could do the same thing over here for this skin. Folks, this now is ready to accept compound butter. Look at this dissection. Okay, now here there's resistance. If I was using only my fingers, look, resistance. Do you barrel through that and risk buttonholing the skin, creating a defect in the overlying skin? No. You get your retractor in there, you get visualization. Okay, now look, there's the resistance point right there. That's what my fingers couldn't go through. We're going to get our scissors. We're going to spread and snip. Spread and snip. And now, as you'll see in a moment, we now have full access all the way to the posterior aspect of the bird. There's been no buttonholing. Look at this access all the way.